What causes mental illness? Mental disorders are believed to be caused by a combination of biological, environmental, and psychological factors. In this module, we will examine several theories that identify the cause of mental illness. We will also look at various treatments for mental disorders. Mark has been depressed for a long time. He struggles waking up every day because he thinks he has nothing to live for. The biological model of abnormality considers psychological disorders to be symptoms of biological problems. In this etiological model, Mark experiences depression because of a chemical imbalance in his brain. This model is popular as it can be scientifically tested, and there is a high success rate in treatment. Brain scans and other technological devices help psychologists to explicitly examine what is going on inside patients' head. Mark, in this case, has evidence that his brain functions differently and could be given an antidepressant drug for treatment. Other psychologists might find that Mark's depression is due to repressed memories from trauma during childhood. Sigmund Freud's psychodynamic theory states that mental issues are caused by conflicts within our subconscious mind. People will not always know what causes their problems because it is beyond their conscious control. Just like an iceberg, the most important part of the mind is the part that you cannot see. Childhood experiences, which can remain in the subconscious, influence our thoughts and behaviors as adults. According to the cognitive behavioral theory, people with depression like Mark have different thought patterns than people who do not have depression. Negative and realistic thoughts cause distress and eventually lead to problems. Mark, for example, thinks he is worthless and inadequate. This causes him to feel depressed. As a result, he has no motivation to improve himself. Compared to most psychology theories that focus on what's wrong with people, the humanistic existential theory provides a more positive approach. It looks at the potential of people becoming their best selves. This theory observes the actions of the healthiest and happiest people and guides others to achieving similar potential. Therapists within this field would assist Mark as a whole rather than just his weaknesses and help him improve his self-esteem. The sociocultural model examines how society and culture affect people's psychological health. Many people feel pressured to measure up to society's standards. Whether it is being married by 30 or having a high-paying job, these standards can lead to stress and mental disorders. Cultural rules also affect how people behave. They tell people what is or is not acceptable and how people should regulate their emotions. This ultimately influences a person's emotional experience. In the United States, people are likely to express negative emotions like anger around others. In the Japanese culture, on the other hand, crying or letting off steam should be done while alone. Now that we have covered the causes of mental disorders, we will examine a variety of treatments. Psychodynamic therapy. The main goals of psychodynamic therapy are to help the client grow in self-awareness and also understand how prior experiences shape their current thoughts and feelings. A therapist, for instance, would ask a client about any unresolved conflicts that he or she experienced as a child. Cognitive behavioral therapy, CBT. In CBT, therapists help clients identify their negative thoughts and replace them with positive expectations. Gestalt therapists view symptoms of mental illness as a result of a person's best attempts to cope with inner and environmental distress. This therapy focuses on self-awareness in the present, allowing a person to move forward from the past with useful solutions in a positive way. Family therapy. Family therapy is centered on the concept that a family is a system with different functioning parts. This means that when one family member is affected by a mental illness, everyone else is affected. The main objective is to strengthen the entire family's emotional health so that everyone can prosper. Although the exact cause of most mental disorders is not known, it is important to be aware of the various approaches to analyzing mental illness. Certainly for some disorders, one model may be more relevant than another. To identify the best treatment models for a specific disorder, It is best that you seek peer-reviewed journal articles, as they provide the most up-to-date research and discussion.